Meanwhile, a few states across the US are trying to figure out why African Americans make up a higher percentage of its coronavirus victims. In Louisiana, for example, 70% of people who have died from the virus are African American, yet African Americans make up 32% of the overall population. And then in Illinois, 72% of people who have died from the coronavirus in Chicago are black, though they make up 30% of the population there. Well, Dr. Raj Kalsi is an emergency room physician in Naperville, Illinois, just outside Chicago, and he joins us now. Doctor, great to have you. Thanks for being on the show. I know it's a difficult question to answer because a lot of the data isn't out yet, but is there anything you could add to why in some places African Americans are dying more from this virus?
It's a great question. This whole thing with coronavirus and how it spreads is a great epidemiologic problem. And so when we look at these things retrospectively, we look at socioeconomic status, we look at access to healthcare, we look at genetic predisposition. And we know as scientists, as doctors, that certain groups of people are more vulnerable to illnesses and certain illnesses. So we're going to have to look back 2020 or even 2022 to see what were the commonalities and what were the underlying conditions that perhaps they all encompassed. Unfortunately, right now it's too soon to tell, but we can look at immediate things like access to healthcare, which is very, very important.
Yeah, it certainly is. And we know that there is a disparity in healthcare for many across the US. And that often is along socioeconomic lines as well, even racial lines. In terms of what you're managing in your ER, who's coming in and who do you think are really feeling who is feeling the brunt of this virus where you are?
You know, it's interesting. Before this hit the shores of the U.S., we were all pretty comforted. I'm 40 years old myself. My wife's the same age, and we were all comforted selfishly that this was more of an illness for the elderly or people with multiple comorbidities, meaning multiple illnesses. But we're seeing young people, 20, 30, 40-year-olds without any significant problems, either come in and get ventilated, come in with severe illness enough to be admitted just with oxygen, or even die from this. So I don't know what the data in 2021 is going to really show when we look back at everything, but it seems like there's not any great disparity between anybody of any class.
How are you guys doing? I mean, it's obviously been relentless. The death toll keeps on rising. Are hospital admissions continue to rise for you?
You know, there is a paucity, there's a lull in terms of our volumes in the ER, but we were warned by other states like New York and Seattle that we would see this. There would be a decrease in the volume because people would be honoring the social distancing, and we're awaiting our surge in the next 4 to 7 days. Unfortunately, the people that are coming in are extremely sick. It's all COVID, in addition to a little bit of a smattering of the traditional ER stuff that we see all the time. But the people that are coming in are extremely sick and sometimes getting ventilated. And on my off days, I'm helping out as much as I can by helping friends and family over text and phone, just to help them deal with symptoms that they may have or their family may have, because I don't want them having to be exposed to an ER or a hospital. And quite honestly, that's the highest risk place to be at right now.
Why? And while you're describing us why, if you could just also describe what's it like in that ER? Are you seeing people come in? How sick are they? What do they look like? And obviously you're having to tell family members to stay away. Just describe a normal day or night in the ER that you've been dealing with.
It's a great question. So the shift starts with a full roster of rooms to see, and they could be as low acuity as the worried well, we call them, people that had a sore throat, people that are otherwise healthy and had a fever and are extremely worried they have COVID, to the extremely sick, people with kidney failure, heart failure, that have low oxygen saturations. And all of them, we have to protect ourselves and put on the correct PPE. And that takes so much time because I'm so nervous for my staff and myself. We need to protect ourselves. So we bounce from room to room to room, taking off this equipment. And for the critically ill that come in, everything comes to a grinding halt. The process of intubating somebody, ventilating them, is a multiple hour process. The initial procedure itself just takes minutes, but then once they're on the ventilator, we need to manage them with medications for up to an hour, 2 hours, depending on when the intensive care unit is ready to receive them. It's highly stressful. There is a lot of anxiety, but I am fortunate to work with the most amazing nurses and healthcare workers that are just weathering this very, very well.
And you too. Thanks so much for speaking to us and also for all the work you're doing. Please send the best to all of your team in the ER. Appreciate it, Dr. Raj. Thanks so much. Good luck. Well
Thank
done.
you, Rob.
Thank you.
Thank you.